Kennett is a small town, population about 11,000. Our school district has about 2,000 students in it, and one of the challenges in the area is poverty. In our school, we have about 56% of the kids are Medicaid eligible.
We live in a farming community, so the environment, maybe the chemicals sprayed in the air, that may contribute. But asthma is very prominent in this area.
The impact is that about 18% of our students have a diagnosis of asthma. So we have a lot of kids that we want to work with, trying to make a difference with them, because asthma is the leading cause of absenteeism in schools. So one of my goals is try to reduce the absenteeism, and one way I can do that is help parents understand asthma, control the child's asthma better, because if the child's asthma is well controlled, then they're going to be in school, they're going to be happier, they're going to feel more normal and be able to participate like any other child can participate. And to me, that's very important for these kids. I don't have to travel anywhere or go anywhere, but I can connect with several experts in the area of asthma, including a pediatric pulmonologist, a pediatric allergist, several pediatric asthma experts that can teach me every time a little bit more about asthma and what's the best way to approach asthma in children, how to address the barriers they may have. Those challenges I can learn about and do it in a way that doesn't take a lot of time, because if I travel, it's usually to St. Louis or Columbia, which is going to be anywhere from 3 to 5 hours. So having it where I can do it here in my hometown with healthcare providers in my community, when they are involved in the Impact Asthma ECHO and we're hearing the same messages, and it brings us together. We can work better together and we're hearing the same information. I think that the outcome is much better for the child. During each session, there's a couple of case presentations done, and then the group decides what's the best path to take for this child, what are the actions that need to happen to improve this child's asthma.
I presented a case for Impact Asthma ECHO. It was about one of my students. He was hospitalized for several days with asthma, and he had not been in my office at all having trouble, so I didn't realize he was having trouble with his asthma. The only time I had seen him was when I do my semesterly asthma checks, where I check his PEF and FEV1. The specialist suggested that we increase his corticosteroid and that we do more asthma education with his parents to hopefully help with compliance at home and then also at school.
I'm encouraged with the Impact Asthma ECHO program and with the other ECHO programs, because this is a way that we can bring more information to more people, and we can connect throughout the state and discuss what resources are there. And hearing the different case scenarios each time is so important, because you can read it in a book and you can feel like you know what you're supposed to know or think you know what you're supposed to know. But when you do the ECHO programs, it's a case presentation, it's real life, it's up to date. So I feel like it's very important for us to continue being involved in it, and I hope more people do become involved in it, because it means that you don't have to travel and that you can bring better care to your patients, or to, in my situation, to my students, to continue to learn from the ECHO program.